Hepatitis is a complex condition marked by inflammation of the liver, with several causes ranging from viral infections to toxins and autoimmune disorders. The most common forms of hepatitis are caused by 5 distinct viruses, named A, B, C, D, and E. Each of these viruses has different modes of transmission, disease severity, and prevention strategies, making hepatitis a global health challenge. Before we begin, make sure to like, subscribe, and hit the notification bell so you never miss out. The way each type of hepatitis spreads varies. Hepatitis A and hepatitis E. Both are primarily transmitted through the ingestion of contaminated food or water, often in areas with poor sanitation. These types of hepatitis are particularly common in developing countries where clean water access may be limited. Certain sexual practices can also spread hepatitis A, hepatitis B, hepatitis C, and hepatitis D. These are transmitted through exposure to infected blood or body fluids. This can happen through unsafe medical practices like contaminated blood transfusions, sharing needles and drug use, or from mother to child during childbirth. Hepatitis B is highly contagious, being 50 to 100 times more infectious than HIV. Hepatitis D only occurs in those already infected with hepatitis B, making it a secondary, more severe infection. Hepatitis can be either acute, which is short-term, or chronic, which is long-term. Acute infections often present mild symptoms like jaundice, which is the yellowing of the skin and eyes, fatigue, nausea, vomiting, abdominal pain, and dark urine. Some people might have no symptoms at all, especially in the early stages of the infection. However, chronic infections, particularly from hepatitis B and C, can lead to more serious conditions like cirrhosis, which is the scarring of the liver, liver failure, or liver cancer. Hepatitis B and C are responsible for the majority of viral hepatitis-related deaths and are the leading causes of liver cirrhosis and cancer globally. Vaccination and prevention. Vaccines are available for hepatitis A, B, and E, although the HEV vaccine is not widely available. The hepatitis B vaccine is especially important because it not only protects against HBV but also indirectly prevents hepatitis D infection. Hepatitis A vaccines are crucial in preventing outbreaks in regions where the virus is prevalent. Unfortunately, no vaccine exists yet for hepatitis C, but antiviral medications can cure over 95% of HCV cases. In addition to vaccination, other preventive measures include improved sanitation, ensuring clean water, safe blood transfusions, and avoiding the reuse of needles. Public health initiatives focus on reducing unsafe medical practices and educating populations about ways to avoid exposure to the viruses, particularly in regions where sanitation is poor or healthcare systems are underdeveloped. Global impact. Hepatitis B and C represent the most significant global health concerns, responsible for millions of chronic infections. It's estimated that 354 million people globally live with chronic hepatitis B or C. The World Health Organization has set ambitious targets to reduce new hepatitis infections by 90% and deaths by 65% by 2030. This would be achievable through comprehensive vaccination programs, widespread diagnostic testing, access to treatment, and educational efforts aimed at high-risk populations. Long-term outlook. In low and middle-income countries, hepatitis is a major public health issue due to limited access to vaccines, diagnostics, and treatments. However, it is estimated that 4.5 million premature deaths could be prevented by 2030 through effective interventions. Despite the availability of treatment and prevention options, many people remain unaware of their infection, leading to a silent epidemic in many parts of the world. Thus, hepatitis remains a multifaceted challenge, but with the right combination of vaccination, safe healthcare practices, and public awareness, significant progress can be made in reducing its global burden. Information in this video is for general purposes and not a substitute for professional advice. Always consult a healthcare provider for your health concerns. If you found this helpful, don't forget to like, subscribe, and hit the notification bell for more.